So thank you very much for having me come and talk to you today about social wellness. Just to give you a little bit of a caveat before I begin, as you've heard, most of my research is in the department or the Faculty of Kinesiology and Physical Education. So a lot of what I'm talking to you today is sort of the link between exercise and social wellness and social well-being. So let's get started. As many of you or all of you in this room know, individuals who are diagnosed with cancer are sort of at risk for a number of additional comorbidities or risk factors that are associated with this cancer diagnosis. So what we talk about tends to be sort of the physical health challenges such as pain and fatigue, joint mobility problems, and we also talk about mental health as being another sort of area that individuals, that there's more susceptibility to things like anxiety and stress. Many women in particular talk about body image. So we know that there's a number of challenges associated with having a diagnosis with cancer. And so part of our role as researchers and clinicians is to find modifiable factors or things that we can do to help offset a lot of these comorbidities or these aspects that happen after cancer. And so it would come to no surprise to those of you who do know me a little bit is that exercise would be one of those modifiable factors. And the reason why we're here today around social wellness is that social support and connectedness is another sort of modifiable factor that's associated with health and well-being. So I'm just going to start. I don't expect you to be able to see any of these lists, but what I do want to show you is that this is a list of many of the benefits associated with exercise in cancer survivors. So just to give you a little snippet of what we're talking about, anything from improvements in survival rates, immune function, physical health, physical functioning, all the way through to sexual functioning, sleep quality, mood, body image, self-esteem. So, and then the bottom there, feelings of connectedness, perceptions of social support. So all of these are factors that are associated with exercise. We also see reductions in things like all-cause mortality, cancer-related mortality, improvements in sort of body fat, so body fat decreases, and then a whole bunch of additional markers. So we see that physical activity, there are a lot of benefits, and that's really what I want you to get from this slide. And so because there are so many benefits, there's been a ton of research looking at the benefits of exercise for individuals with cancer, and there are actually guidelines for anyone who's not familiar with them from the American College of Sports Medicine that demonstrates that exercise is safe and feasible for individuals who have been diagnosed with cancer. And the guidelines generally suggest to avoid inactivity, that individuals should be as active as they can be, and that it's safe and effective, as I said. And that there are exercise programs that need to be adapted for the individual going through the program. So the general message is, because there are guidelines, we know so much about exercise that we can actually create guidelines associated with exercise. We also, for those of you who are familiar, we have a newer guideline in Ontario that Cancer Care Ontario has developed, again, around physical activity, demonstrating that exercise is, again, feasible and safe, and that the benefits of exercise far exceed the potential risks. So that's the general message around the guidelines. So what are the guidelines? For those of you who aren't familiar with those exercise guidelines, it is 150 minutes of moderate intensity exercise, 3 to 5 times per week. Resistance training, 2 to 3 days per week, that includes most of the muscle groups, and flexibility training. And so how many of you in this room would do this amount of exercise? Okay. Any of you doing social desirability right now? Looking better than you do? No. Okay. So what I did want to point out was that these guidelines, which are for cancer survivors, are also very similar, if not identical, to the general Canadian population. So the Canadian physical activity guidelines have also been published for youth all the way across to older adults, and they state basically what's on the screen. So I'll come back to the guidelines in a second. So we do know, because of the benefits, because we have guidelines, we know that physical activity is a modifiable factor that can help with the cancer experience. However, about any range from, we know about 57 all the way across to upwards of 90% of individuals diagnosed with cancer are not exercising at levels that can gain health benefits. And these numbers, the big range is technically because if we do self-report, where people are filling out a questionnaire, they tend to say they're more active than if we actually put on an accelerometer and measure how active they are. So there are a little bit of bias in the measurements, but when we measure people's activity levels, generally speaking, about 4%, between 2 and 4% of one's day is moving more than what we're doing right now, so more than sitting. So higher intensity exercise, about 4 minutes a day, which is pretty minimal. I think you'd probably all agree with me on that. So what can we do? Basically what we need is to get people more active and less sedentary, as I've mentioned. I didn't put on the previous slide about sedentary behavior. However, we know that upwards of 80% of one's day is spent sedentary, meaning completely sitting still or laying down. So again, a good portion of one's day is a direction that we could intervene on to help people move more. And then, so we're just going to go through how to get people more active and then understanding the barriers to exercise as well. So there are many concerns to exercise in cancer survivors. I've chosen the 3 that we hear pretty much every day. Not enough time, can't do enough, and it's too late to start now. I've already been diagnosed with cancer. So I just wanted to spend a couple of minutes talking to you a little bit about these 3 reasons for lack of exercise. The first is the can't do enough. And this is where I'm going back to the guidelines that I already mentioned to you and telling you that the guidelines are there as just that, as a framework. However, one of the challenges with something like a guideline, 150 minutes a week of moderate intensity exercise, is that for many of you in the room, it's not possible, or it's not yet possible. And therefore, what I would recommend is that we have to pay more attention to the light type activity, or helping people move more, because if we can get people to move a bit more, then that builds confidence. That confidence then leads to more exercise, and over time, that goal of 150 minutes, if you want that goal, can be achievable. However, if I told you all today that starting tomorrow, I want you to exercise 150 minutes next week, I'm basically setting you out the door for failure, which is not fun for anybody. So really just keep in mind, and the message, one of the messages that I want to send around exercise today is that moving more and finding exercise that you enjoy, even at lighter intensities, as I said, can build confidence, can allow you to see that things can be done, and that will be a more achievable goal. So this is just a little diagram that I like to show you in terms of how we say that any exercise is good. And as you heard earlier, most of my research actually centers around social and mental well-being more so than sort of physical health. And so when we talk about light intensity exercise, the exercise that people actually enjoy doing, we see a lot of social and mental health benefits associated with that level of exercise. So just to give you a sense, there's a concept, it's called non-exercise activity thermogenesis. So if you want to sound really intelligent, you could probably tell people that you learned about that today, or the NEAT principle. But ultimately what it is a demonstration of, the first line that I just put up here is basically the person who might meet Canada's physical activity guidelines, or the cancer guidelines. So this is the type of person who might sit down for most of their day and then go for a walk or a run or a bicycle at lunch hour for that half an hour a day, go back, sit at your desk or on the couch or whatever, sit while you eat, sit watching TV, go to bed. So this is the typical graph of someone who might, let's say, do enough exercise. Now the next graph is the type of person who kind of just puts more movement into their day. So if you would think about it, just getting up from sitting positions more often, getting more water, getting up to go pee more often because you drank more water, never really intense exercise, but always moving throughout the day, consciously taking more choices to move more. And this, if you look at the area under the curve between these two people, you could see that the area under the curve, or the amount of energy that's expended, is actually more if you just make a conscious effort to move a little bit more. So this is just a hypothetical scenario, but one that you can hopefully think in your mind to make decisions just to, again, move a little bit more throughout the day. The other thing that we need to do is to change the definition of what exercise is. So when we say exercise, we really don't or shouldn't mean just biking, running, swimming, the typical, or gym. It's about moving more, as we said. So enjoyment is the key. When I'm asked to do, in media interviews and stuff, when people say, what's the best exercise? Or if you guys are thinking that right now, sitting in your chair, what is the best exercise? I can't tell you what the best exercise is. The best exercise is the one you're actually going to do. Because if I tell you that running is the best exercise and you hate running, you're never going to do it, there's no benefit to you. So find the exercise that you find most enjoyable. That's the key to moving more. There's a ton of gadgets and apps out there. You can use your own home to move a little bit more. Standing up from the couch or from your chair, is an easy exercise. And adding lifestyle activities to generally to your day. This is a good, a new map. It doesn't come out very clearly, but you can find it online. Someone has actually gone, I had this idea so many years ago and never obviously had time to do it, but someone actually planned out the walking distance between the TTC subway stops. So if you get off the subway, a stop early, you can pick which one, how far you want to walk, and add movement to your day. So that is if the subway actually moves in Toronto, but you can actually probably walk faster most of the days, is my opinion anyways. That someone has actually done this for maps in Montreal and in Vancouver as well, to give a sense that it is possible to sort of get off the bus or the subway a stop or two early and get a little bit more exercise in. One of the other barriers that we often hear is that it's too late to start. I've already had cancer. Why should I bother adding something else to my day? Why should I bother exercising? And really, if you just think back to that graph that you couldn't read, the whole list of benefits of physical activity are there. So it's no such thing as it's too late. It's never too late to start moving more and integrating exercise into your day. One of my colleagues, this is an older study now, but a lot of the research actually shows that it's the change in exercise from post-cancer diagnosis and treatment. It's the absolute change that matters most for quality of life, more so than what you did in your past, in history. So what you do tomorrow, starting tomorrow, is really important to overall health. Okay, so once we deal with sort of those main barriers, the main things that I just talked about, we also need to understand how else we can help people become active. So what we're trying to do right now is a number of different research strategies to try to figure out how we can get individuals, and in particular in one study that we have that's funded by the Canadian Breast Cancer Foundation, is to find out what we can do for women to get them more active. And for those of you who do want to contribute, we do have an online survey right now looking at trying to understand what women want and need in terms of physical activity so that we can help people become more active. So the goal of this research is actually to develop resources that can be accessible to people to help them exercise more. So just to give you a little sense on this initial study, what we have so far is 164 breast cancer survivors who have given us information on what they need in terms of physical activity. We also have done environmental scans of hospitals and cancer clinics all across Ontario. We've evaluated any physical activity text manuals or resources that are available in the hospitals, and we've done a website evaluation to see what's offered in terms of physical activity resources or information. And based on the culmination of all of these materials, we'll be able to identify where we can help improve the physical activity landscape for cancer survivors. As of now, this preliminary study, my PhD student just quickly ran the numbers in terms of giving you a sense of what we're finding. And the biggest thing that women are saying is that advice from an exercise professional and finding an exercise partner who understands cancer, as well as social support from other cancer survivors, are sort of high on their list of things that they have difficulty finding as of now. So we'll talk a bit more about all of these in the social wellness part. So what I want to also point out is that in the guidelines for physical activity, the researchers also suggested that we need to also understand, like I mentioned earlier, we have to change the landscape of what exercise is. We need to understand other types of research, such as Pilates, yoga, martial arts, curves, organized sport, to be able to figure out what the benefits of all of these different forms of exercise are. So as you heard early, my career in this area started from dragon boating. So for those of you who aren't familiar with dragon boat, there's a picture on the screen there. And it's a large, basically, canoe that 22 women basically paddle in together. And what I was interested in was how does that function? How do 22 women in a dragon boat, what are they getting from this exercise? What are they getting from the social dynamics? Do you have to like the person that you're sitting beside? Do you get along? What happens in this environment? And ultimately what we found was that even though women said that they didn't join for social support, all of the women that we've interviewed over the years have said that they've gained it. So gained that social support, if they need it, it's there. And that is extremely critical for their quality of life. We've also done some evaluations of curves. I think they're on the down low now, but when they were sort of at their height, we actually gave Curves memberships to over 400 women that had been diagnosed with cancer in the Montreal area, and we wanted to evaluate whether women enjoyed being in the sort of real world to exercise, what they got from Curves. And so we did interviews, we did survey research with this, and then we also did an intervention where we gave half the group Curves memberships and half the group Canada's physical activity guidelines to see if we could improve exercise with those memberships. So not to spend too much time on this, but basically what we found was that the women sort of liked and didn't like Curves, ultimately. Very few of them went, so we gave them free memberships for a year. It's about a $400 commitment per person, and about 8% of them went more than 10 times. So it's a big, obviously, investment to try something out. It wasn't out of my money, which was fine. But it's also disappointing to see that when there are environments that people can go to, there was 106 Curves locations in Quebec, which is where I was at the time of this research. And so there was basically one Curves in about 20 kilometers was the furthest any woman had to travel to go to Curves. So what the women generally found was that they liked the environment, the pace. They got some social support, which they were not necessarily looking for. But what they really didn't like was, was the environment. The pace was either too fast or too slow. And the staff in Curves, they found that they weren't really trained to work with cancer, with women who had cancer. And that was a real downside to the program. So I won't, you don't have to read the first quote, but the second quote really says what I just said. So teach the people at Curves the reality of breast cancer patients. You're supposed to be helping me, and I'm the one that knows more than you. So the general sense that there needs to be more training that happens for these women to feel like they could use something like this environment. So in conclusion from that research, we really found that free memberships aren't effective. We know that. We know that people have to make some investment to get something out of it. So that probably makes some sense. The local aspect of Curves and the social support was extremely important from that research in these exercise environments. We've also done a number of different projects looking at women who have climbed Mount Kilimanjaro. We've looked at, as I mentioned before, dragon boats. We've done a number of interventions around the idea of exercise in groups or in individuals. And basically the ultimate idea is that women in particular, but men as well, gain socially from exercise in group formats. We also know from some of our other research that one of the main barriers that I already didn't talk about is that idea of lack of social support or not having that person to exercise with. And so the lack of companionship, lack of support for exercise does tend to be a barrier that we hear. And our questionnaire that we're doing right now, the women are telling us that they want to find people to exercise with as well. So just to give you a summary of the exercise and group literature, basically what we know is that individuals who exercise in a group, there is this positive social support that they gain. It does create an environment for disclosure. Like I was saying with the dragon boating, if you want to talk about cancer, you can. You know it's there. It's sort of like a foundation, but you don't ever have to speak it, and people are fine with that too. Acting as a sounding board to help each other through challenges, and a role model to positively rebuild following cancer. So these are some of the important aspects of group exercise that we have found in our research and others have found as well. Just a side note, because we are here today to talk about social wellness, is that up until fairly recently, the literature around group exercise was showing all these positive effects of the activity. So it was saying the physical activity was so good for self-esteem and for confidence and for building and post-traumatic growth and all of these things. But when people are going back and either reanalyzing their data, controlling for the social aspect of a group, we're finding that the benefits of exercise are far less than the benefits of the social nature that people are getting from the group exercise. So when we do these types of groups, it's about the physical benefits of the exercise and then the social and the emotional benefits of both the social aspect as well as the exercise. So just a side note there. So what is social support? Generally, these are, obviously the sort of more theoretical definitions, but we really think of social support as having both a structure to it. So how many people do you have in your network or your connections in your life? And then what do those people provide for you? So the functions of social support, which are important as well. So do you have people who give you information or help with emotional control, positive mastery, so give you reinforcement and encouragement, and then the tangible, which I guess we probably all think we need more of, people who give us things. So pay for things, pay for memberships, give us rides, take us places, that kind of thing. So what we know, and I looked around the room before I gave this talk, and we've had a couple of men, but ultimately, it's very interesting to me that the day is about social wellness, and there's very few men here, which does speak to the literature tremendously around this issue. Generally speaking, men have more connections, but less sort of the functions of those connections are less intensive, I guess you could say. Women tend to report both getting more support as well as giving more support. And the link between mental health in particular is stronger for women around social support than it is for men. However, some of the literature shows that lack of social support is linked to more physical health problems for men than it is for women. So the dynamics around social support are very different for men and women that we have to take into account when we're doing any kind of research in this area. The other thing that we use in our lab quite a bit actually is this idea of sort of across the lifespan how social support needs change over time. And so basically the blue curve that you see here is the information, the needs that someone has for knowledge. And you can think of in youth and younger ages, it's about knowledge generation. You want more information, more information. And then those needs kind of drop off in older age. Whereas the emotional needs are quite low in adolescence. They say, get away from me, I don't want anything to do with you. And then over time, those emotional needs actually increase with age. And so it's just something that we have to pay attention to when we're doing interventions, to think about what people want and need around social support. I was thinking of trying to describe this as your Facebook friends versus something else, but I couldn't think of the other comparison. But you think of everybody that you have in your network, but then who is really close to you, that's meaningful to you, is sort of smaller as we age. And so that's sort of the key, is comparing a Facebook page of a teenager to someone in their 50s or 60s would look very different because of these needs. In some of our research, we've actually sort of studied that theory around social support changes. In one study that we have ongoing, we're looking at changes over time after treatment for breast cancer. And what we find is that social support quantity decreased in these women over the year after treatment, whereas the quality did not change. And so, again, sort of culling or getting rid of those people who aren't as meaningful or providing as much in your network, but having that same level of quality is important. and that if individuals did have a decrease in quality, it was related to increases in things like depression, stress, and negative affect. So we want to be able to try to maintain social support quality as best that we can after cancer diagnosis. So as I mentioned, one of the common reasons, I hear this all the time, is that women would tell me, if I just had someone show up at my door and drag me out of the house, I'd exercise. So don't we want someone to do that every day? No one to help support me for exercise. We know that social support is key. It's one of the key strategies that we need to focus on to get people exercising and to keep people exercising. And we also know that social support changes after cancer. And so what we really need to do is focus on enhancing this idea of social support and social well-being in the aftermath of cancer. It's also identified in the Cancer Care Ontario guideline. The main difference between the American College of Sports Medicine guideline for exercise and the Cancer Care Ontario guideline is that the latter, the Cancer Care Ontario guideline, actually highlights that people should be exercising in a group to any extent possible. So the group aspect or the social aspect is highlighted in that in the newer exercise guideline. So I guess the question is, what if we help people find support for exercise? What does that look like? So we've done a couple of studies where we've tried to identify social support needs for women in terms of exercise. The first is what we call Project Move, and this is basically where we got a grant from the Canadian Cancer Society, and then we have women get together in groups of up to 10 survivors, and then they tell us what they want to do for exercise, and then we give them money. So basically, the women get together in groups. They say, we want to bring in a yoga instructor for 12 weeks. And then we give them up to $2,500 for that program. And what we're doing is, it's kind of twofold. One is that it allows women the autonomy to build their own physical activity program or movement-related program. And two, it allows us as researchers to understand what women really want. It's best to find out from you on the ground what you want in terms of an exercise program rather than us setting it up in a lab and having you exercise. So we're really gaining a lot of knowledge around how to help women in particular exercise in this way. The other study, which there will be demonstrations, I think, later, and we're sort of, there's a table out behind us that we're focusing on, is also a grant funded by an innovation grant from the Canadian Cancer Society, where it's called Active Match. And ultimately what this service or tool is helping women find an exercise partner. So ultimately what it is women can go online, answer some questions about their own history, their profile, what they like about exercise, give their postal code in terms of finding someone who's local to them, and then it either matches the behind the scenes that I don't understand at all, finds the match, or the women can actually search through profiles of women who have said stuff about themselves and message them throughout the system to ask them if they're interested in exercising together. So to build this service, or this tool, I guess, we did a number of things. So we've done a number of interviews and focus groups to find out what it would look like for a woman to have their perfect exercise partner. So what women told us was that age was important, or in general, life circumstance. So some of the women would say, it's not really age, but if I don't have kids, I want to work out with someone who's not running home to make dinner for kids, kind of thing. So life circumstance, distance from the home, as I just mentioned, interest in exercise, type of cancer, treatments, severity of treatments, and then exercise history was discussed, as well as personality. So these are types of questions that women can fill out if they want in the Active Match system to be able to find an exercise partner. If none of these things are important, then you just have to go online and look through profiles and see if anybody's there in your community or in your neighborhood that you would want to exercise with. So this is just a screenshot to show you what one of them looks like in terms of profile details. So types of favorite activities that people can look up, and again, write out profiles that can then identify sort of connections or matches in the community. We also have location, history of physical activity, and the goals, as I mentioned before. So the screen pages look like this, but we ask all the questions that we've found out from women beforehand, what they want in an exercise partner program. We also have the physical activity readiness questionnaire, so that if women are not able to exercise or have any comorbidities that might constrain exercise or movement, we want to make sure that they see their physician before they actually partner with someone and engage in an exercise program. So if this is filled out and someone says that there is a condition, then we flag, then they're not able to go in and profile and match themselves until a physician's note is uploaded into the system. So there is that little help to make sure that people are exercising within the constraints of their health. So basically what happens is women can go into the system, review profiles of individuals. We did have up to, at one point we've had upwards of 140 or 160 women in the system, and very few of them were putting in their picture. And so when we had open houses where we were trying to discuss what was going on, the women said, well, I don't want to put my picture up there. And one of the challenges with a site like this is that a picture is actually a safety mechanism. So if you can see someone's photo, you actually have a connection to that person that sees that it's not, anyone off the internet, for example. So we've been trying to identify the importance of a photo, and we've actually made several changes over the last year as we've had these open houses and learned from women what's working, what's not working. And one of them is that we will be very shortly having little images, but not your photo. So like you can pick a, what do you call it? What's those? Emoticon or whatever, where you can put a picture, but it's not your own if that's important for someone. But the other things is that within this system, individuals can message within the system so that you don't have to give your own personal information. It's all safe outside, and then as soon as you feel comfortable, information can be shared like any other service or tool or whatever. So basically what we've been doing, we've had a lot of women interested in this service across Canada. And so, for example, if we're pushing it in Toronto, a woman in Halifax signs up and says, what do I do? So basically what we've been trying to identify is that it's important to have someone actually physically exercise with you sometimes. It's also important just to have someone who can keep you accountable. So that person who checks up on you or sends you an email every now and then and asks how things are going, or I found this exercise, you should try it, it works really well, or something like that. So keep the dialogue about exercise going without necessarily being side by side and exercising. So you can find a video about Active Match on YouTube. We also try to have a presence on Twitter and Facebook if you're interested. And so I just want to finish this talk off with identifying that, the whole idea of this is around social wellness and social well-being. I've added the exercise spin on this, of course, with my background. And basically what we have is similar individuals will exercise more, will support each other more, and will keep to an exercise program. And so it's extremely important to have someone else that can help, again, keep you accountable. I wrote up here, help you get out the door, and give you support, challenge you in ways that you won't. It's very easy to do very easy things. If you can challenge yourself a little bit through movement, it's great. And find the exercise that you enjoy, as I've already mentioned. And just to highlight that this is a medieval torture device and an exercise equipment. And if you have gone into a gym, you will see that there's similarities between medieval torture devices and exercise equipment. And so the key challenge is really find your social wellness, find the activities that you enjoy. There's no right or best exercise. It's probably not the medieval torture devices. And go out and move a little bit more for social wellness. So just make each day a little more active. Don't take the escalator up to the gym, basically. So just to finish off, I just wanted to acknowledge the various funding that I've had for the research that we've been conducting in this area. My colleagues from the various studies that we've been doing, both with women with cancer, breast cancer, as well as men with prostate cancer. all the participants of our studies, my 2 main project managers, and a number of, the list of students I've had is far in excess of this, but the ones that are working in oncology right now to help improve this area of research even more. So thank you very much for your attention.